Hello and welcome to the Curated Beauty Podcast. I'm Jessica Christie, CEO of Beauty Culture Med Spa and the founder of the new functional and regenerative business, Cultured Wellness. From my start as a physician assistant to now not only being a practitioner but leading my own businesses, I've been on a unique journey through health, beauty, and entrepreneurship. Join us as we explore everything from skincare secrets to leadership lessons. Whether you're passionate about beauty or striving to balance life's challenges, this is your space to connect, learn, and shine. Let's dive in.
Hello, everyone. I want to talk about something really important today and give you a really good basis for maybe some of the ways that you've been feeling and some validation and some direction on where to go. Now, let me paint the picture. Doctors across America record more than 500 million patient visits in regards to fatigue. And I hate to be the bearer of bad news, but the sad thing is that these patients are rarely finding a root cause and being healed. Being tired is becoming so normal. It is something that is widely acceptable, and it is basically the equivalent to breathing. So when we think about all the things that you would do for fatigue and all the things that the doctors sidestep to tell you to do, basically they're recommending exercise programs, healthy diets, more sleep. And while that's all really, really great advice, patients will do this and they fall off the train because they're no closer to identifying the root cause of why they truly feel horrible after 8 hours of sleep and after eating a healthy diet and after all the things that we may be doing, taking some supplementation, even adding some bioidentical hormones. I talk to women every day that maybe they have an estrogen patch and they're taking some micronized progesterone at night, but they still haven't fully eliminated the exhaustion. And so what I want to kind of brush over is how important, and talking about actually what's going on, we have a major crisis in people not recognizing the fact that thyroid is a hormone and it's an essential hormone. And just as our other hormones decrease with age, so does thyroid. And thyroid insufficiency is really, truly something that commonly occurs as we age. It's not something that you typically will not suffer from or succumb to. And women are much more susceptible to this than men. Something that throws another wrench into the situation is that we have women suffering from perimenopause and menopause symptoms at the same time, and they're very familiar symptoms: forgetfulness, depression, mood swings, muscle weakness, changes in your hair or your skin texture, sleep disturbances, overall mood disturbances, just irritability. Many doctors will overlook the thyroid, and they may prescribe menopausal treatment and some MRT, menopause replacement therapy. But really, when we look at the full picture of hormone replacement therapy and the bioidentical versions of such, thyroid is not to be left out, because more often than not, we're finding that these thyroid hormones are in the low to normal or insufficient range, but doctors brush over them because they still fall in this normal range. What we really have to exercise is to stop treating the labs, stop treating the ranges that we see that are marked H for high or L for low. What we really need to do is start treating the patient. And it is a responsibility of a healthcare provider to increase the well-being of a patient despite what their labs show. Because again, like we've talked about before, who freaking picks these lab values? When we look at your age and we look at your gender, there is a range within normal limits. We used to write it on our charts all the time in my rounding days, WNL, within normal limits. But who says that is your normal? Why are we not, again, looking at optimal levels for what you were when you were functioning well? Symptomatic improvement truly only happens when serum levels reach this optimal range. And serum levels in the low normal or the mid-range are not where a person feels good. There's just honestly this misunderstanding and this confusion lie where most people over the age of 40 have low baseline levels of thyroid issues. And normal, again, is not optimal. Normal can cause a person to experience all these symptoms of hypothyroidism and then go to their doctor and say, I've gained weight, I don't feel good, I'm fatigued, I feel depressed, I'm having mood issues, and they're told they're normal, and they just go on about life and feel really, truly depressed about what's going on. And I do want to talk about that because depression and fatigue top the list as common symptoms of insufficient thyroid levels. Yet when we go to the doctor, they're dismissed. These symptoms are really never diagnosed as being low T3 levels or thyroid insufficiency. When the blood levels don't reveal any abnormality, they declare the patient healthy and they dismiss the symptoms as psychosomatic and they prescribe antidepressants that don't work. And so then when they don't work, it's even more critical on our physical well-being and our emotional well-being that this is something that's not a good fix. It's just not a good fix. And so we really need to help people to identify finding a provider. It's really simple. It's finding a provider that will actually perform the tests and are able to prescribe optimal supplementation with hormones that are going to make their patients feel better. And with lack of sufficient thyroid hormone, we can see that people cannot think clearly. They have clouded minds. They have hazy judgment. The real problem is that our providers don't have the confidence to really support blood levels of optimized thyroid levels. But we do know that through the Journal of Clinical Endocrine Metabolism, a recent study showed that patients felt the best on the highest amount of T3, which then caused TSH suppression. So if we go back to the basics of thyroid and what's going on and where this thing is in your body, most people know that it's a butterfly-shaped gland in your neck, and it wraps around the front of your windpipe, and it varies in height and weight, but it's usually about an ounce, it should be. And it's only secreting about a tablespoon of this metabolic hormone per year. And the majority of this hormone is then bound to a protein, making it completely unusable and useless for our surrounding tissues. So this is really significant because thyroid hormone is critical to growth, differentiation, all of your metabolic processes of each cell in your body. It helps you to regulate your temperature. It helps you to stabilize your mood, like we talked about. It increases breakdown of fat. So it's lowering your cholesterol levels. It's protecting against heart disease. So it's really, really imperative that we kind of get technical and we know what these thyroid hormones are doing so that you know what's happening. The two thyroid hormones that are secreted are thyroxine, also known as T4, and triiodothyroxine, which is T3. And about 80% of the thyroid hormone we produce is T4, which is the weaker thyroid hormone. And then T3, the active hormone, makes up about only 20% of your thyroid hormone, yet it's 4 times stronger than T4. And it's that conversion from T4 to T3 that makes the thyroid hormone active. And therefore, we kind of refer to that T4 as a prohormone or like a precursor to the active hormone. Another important hormone involved is TSH. So TSH is in the anterior pituitary hormone that stimulates the function of the thyroid gland. And it's the hormone that sends the message to the thyroid gland in the neck to make more T4, to make more T3. So it's produced by the pituitary gland in response to signals from the hypothalamus gland. This thyroid also produces calcitonin, which helps us metabolize calcium and really strengthen our bones. It has so many factors in our body, and we can't just throw a random synthetic prescription at it to make it do its thing. It's really, really important. This is something that's pretty technical, and we would advise you on as a patient, in terms of which form you need, what's going on with your thyroid hormones personally, because there's autoimmune disorders that are involved. And in fact, we just saw someone who came through our practice. She said, "You guys, I'm so excited. I got my IUD out because I learned about synthetic hormone being harmful. And I'm so excited. But since I've gotten my IUD out, I have gained 15 pounds. I feel fatigued. I don't love it. I'm waiting for my hormones to normalize." And we were like, whoa, what's going on here? Because that really shouldn't be the case. It's not typical. And so she said, "Yeah, I got my labs done. I got my thyroid checked. And my doctor said, it's fine. There's a little number that's a little bit elevated, but it's not high enough to do anything." Well, upon further review of these labs, she actually had Hashimoto's disease. And I truly believe, not out of malice, but out of just not knowing what to do, this doctor just dismissed her when 1000% a huge cause of her fatigue, her mood instability, her weight gain is associated with her thyroid not functioning correctly and having active Hashimoto's disease. And yeah, I mean, a lot of that starts in the gut. She needs gut support. She needs detox. She needs all of these things and probably a little bit of active hormone to help replace and help support her and why she's feeling so terrible. And to be honest, so many women, when they find out the cause of why they feel so horrible, it's almost like a sigh of relief because there's finally an explanation for the fatigue, the depression, absent-mindedness, all of the things that you feel like, man, why do I feel like this at such a young age? So really, truly, TSH levels can indicate an illness or a deficiency. I firmly believe in the importance of measuring a free T3 and a free T4. T4 levels will not always tell you the truth about thyroid insufficiency, nor will the TSH. The most accurate information is when you look at the three and how they're playing together, and then, of course, getting antibodies when we need them, and really arming yourself with the adequate information of what's happening in your personal situation. A lot of people will think like, should I be taking thyroid medicine? Like, I don't want to start taking something. Well, it's the same thing as a lot of the hormone replacement therapy. Sometimes it is fixing your gut and allowing your body to function better and this gland to be able to function better. But also remember, we lose it with age. And so sometimes we just need to replace it. There's a huge debate on which kind of thyroid replacement we should be taking in thyroid deficiency. And there's exact replicas of what your body makes, which is the natural hormone replacement that we use. And this is essential for the body to really, truly bring this hormone in and use it as it does in the body. This is Armoire, NP thyroid. My preferred choice for this is NP thyroid. We just see really good absorption, good sustained levels, and pharmaceutical companies have financial incentives to push the synthetic forms, the levothyroxine, just as they do with progesterone. The body naturally responds again to two types of thyroid hormone. It's T4 and T3. And without optimal levels from both of these, your body will remain deficient in the hormone. And so you could be taking these synthetic forms of thyroid hormone, but your body can't actually be getting what it needs and feeling better. So if you are taking thyroid replacement and you still are suffering from some of these symptoms, it's very likely that you're not on the appropriate forms because these synthetic forms, all of these only contain T4. And remember, T4 needs to convert into T3 to be active. And are we doing that? It's really hard to convert into T3 as we age. And so the company is arguing these synthetic forms are offering a more steady, controlled release. They just don't convert. They don't do a good job at converting, and then they're going up in the dose, and there's other issues going on with that. So for the physicians that are only focusing on the TSH, yeah, they're going to see that it goes down and back into a normal level because the T4 is giving that negative feedback loop. But it's the T3, that conversion of 4 to 3, that is really important for us to be able to see the difference in our symptoms. So really, really important. It's really important to understand, again, that as we age, we have a decreased production of T4, a decreased conversion from T4 to T3, especially after 40. And then we also have this concept of decreased sensitivity at our receptor sites. So it's almost like diabetes type 1 and type 2. Type 1, you don't even make the hormone. Type 2, you're resistant to it. So we kind of have that going on with thyroid as well. So how can you be heard? How can you get your doctor to listen to you? Well, sadly, preventative medicine is more cost effective, but doctors don't think about it that way. It does take a while to educate a patient, not as much time as you think, more so yourself as a provider, on gut health, on getting rid of heavy metals, detoxing the body, doing it correctly. But it's really 5 minutes to explain it to your patient. And of course, I believe in having payment options and keeping it as affordable as we can. The bottom line is you don't have to slow down. You can replace your thyroid to optimal levels, just like they were in your 20s and 30s, not just the normal levels. And this is, with all the other hormones, going to be so beneficial in helping you to feel your best and feel optimal. So I just wanted you guys to have this little snippet on thyroid health. We can dive deeper. I'd love to hear your questions. I'd love to hear other topics that you want me to uncover. And of course, I welcome you to take our virtual tool that you'll hear after the show and to call us and to become one of our patients, or find a provider that you feel comfortable with, that you know will take the right labs and listen to your concerns and then implement the correct plan for you. So thank you for joining today. I look forward to hearing your comments. Get in touch with us. Use the show notes. Don't forget, as always, to share this podcast with other people that may be feeling the same way. Don't hesitate to review our show, and don't hesitate to subscribe so that you can get pinged when we have new episodes that launch every single Monday. Take care.
Thank you for joining us on another episode of the Curated Beauty Podcast. If today's discussion sparked your curiosity, or if you're ready to take the next steps in your wellness journey, we invite you to explore our new virtual wellness tool. It's an easy and convenient way to assess your needs and connect with our expert team for personalized guidance. Visit our website, beautyculturespa.com, to get started, because your health and beauty deserve nothing but the best. Until next time, stay radiant and take care.